Hi friends, I am Dr. Niranjan Naik, Senior Director of Surgical Oncology at Fortis Memorial Research Institute, Gurugram. So we all keep on hearing the one or the other of our known people, either our relatives or friends, somebody's relative is getting cancer. Like it's a common disease nowadays. So the overall incidence of cancer has increased. If you see the statistics, every 10 to 15 years the incidence is nearly doubling. So how we can save ourselves from this dreaded disease? So cancer is a lifestyle disease. So if we follow a healthy lifestyle, the risk of getting cancer is can be reduced. Risk can be reduced. So now let us see what are all the early signals of cancer. So there are some cancers which are common, incidence is very high. Like among females, breast cancer is number one, and among males, it's oral cancer, head and neck cancer, then lung cancer. So if we have to detect, now in cancer, the best thing is early detection is best protection. So if we can detect cancer in early stage and get a proper treatment, then cancer can be cured nearly 100% in some cases, or 99.9% in significant number of cases, different types of cancers, if it is detected in early stage. So to detect cancer in early stage, we should know what are all the early symptoms or early signals of cancer. So I will be talking about this. So early signals of cancer is remembered by a mnemonic called caution, CAUTION. Now we will take each letter. C for change in bowel or bladder habits. So if there is any change in your bowel habit, bowel means your stool habit, passing motion, whether you are earlier used to have normal motion, now one has increased frequency, or constipation, or change in bladder habit, urinary bladder habit, like person has to get up more in the night and has to go for urination very frequently, or there is any difficulty in pass urine. So any change in bowel bladder habits can be a sign of cancer. You should go to the doctor. Now next is A, any sore which does not heal. So any ulcer or any wound, any sore in any part of the body, like especially people who eat tobacco, the most common presentation of oral cancer or mouth cancer is ulcer in the mouth, ulcer on the tongue cancer presents as an ulcer on tongue. So any ulcer in any part of the body, whether it can be an ulcer on the skin, or if endoscopically, if we see ulcer inside the stomach, so endoscopically it will be seen. So any ulcer which does not heal can be a cancer. You should go to the doctor, and most of the time you will have to do a biopsy. Now U is unusual bleeding or discharge from any part of the body. So any unusual bleeding from any part, like blood in the urine, blood in stools, blood in sputum, blood in vomiting, or blood in cough. So this can be a sign of cancer. In females, nipple discharge, bloody nipple discharge, or any nipple discharge can be a sign of cancer. And any abnormal discharge from any part of the body, especially for cervical cancer patients, foul smelling discharge from the vagina can be an indicator of cervical cancer. So any unusual bleeding or discharge, you should go to the doctor. Now coming to next letter T, thickening of lump in any part of the body or in breast, etc. So any thickening or any lump if you feel in any part of the body, it can be an indicator of cancer. So the most common symptom of breast cancer is painless lump. So most of the time people don't go to the doctor because the lump is not painful, because it is painless. They keep on sitting waiting that it will become all right by itself. Anyway, it is not paining. So with that thinking, they will not go to the doctor and delay the diagnosis as well as delay the treatment and help in advancing the disease to a higher stage. So any lump in any part of the body, one should go to the doctor. Now next letter is I, indigestion or difficulty in swallowing. So indigestion or difficulty swallowing is indicator of stomach cancer or food pipe cancer or intestinal cancer, or sometimes it can be a sign of ovarian cancer. So if somebody has acid problems like dyspepsia or indigestion, vomiting, and difficulty in taking solid food or even liquid foods, then it can be a sign of cancer. Now coming to next letter O, obvious change in wart or mole. So this, most of the people have black mole or like warts or moles on the body, so which may be there for quite long period. But if there is any change, recent change, suddenly there is a change, it has increased in size, shape. Earlier it was totally round, now there is a abnormal, irregular borders, and it is spreading and it is becoming hard. Earlier it was soft, now it has become hard, or it is becoming painful. So if there is any change in mole or wart or any black mark on your part of any part of the body, so it can be a sign of cancer. So you should go to the doctor. Now any nagging cough, last letter is N, nagging cough or hoarseness of voice. So any cough which is lasting more than 1.5 months, even not getting all right even after proper treatment, it can be a sign of cancer. So most of the time it is indicator of lung cancer or voice box cancer, laryngeal cancer, or throat cancer, etc. And it can be an indicator of thyroid cancer as well. Then hoarseness of voice, where it is a mainly vocal cord cancer or any voice box cancer can be, and even thyroid cancer can also cause hoarseness of voice. So if any, these are all common symptoms of common cancers which are happening nowadays. So if you know these symptoms, you will be able to identify the symptoms early and go to the doctor and get the treatment in early stage, thereby increasing the possibilities of complete cure. So remember this and spread this knowledge among your friends, and strictly say no to tobacco as well as alcohol. Tobacco in any form you should stop, and say no to alcohol and live a healthy lifestyle. With that you can prevent this disease to a significant extent and live a longer life, healthy life. Thank you. Good luck.